Hi guys, welcome to our podcast. We are the Public Health Rookies.
And we are Masters in Public Health students at an undisclosed university, but you can easily find out by looking at any of our Instagrams. And we're really excited to be here. This is Joe, I'm Akila, Rachel, Will, and we have Faris behind the camera. So we basically kind of started this podcast because we wanted to share what we're learning in classes right now, as well as kind of tell and share our stories and our experiences in the public health field. And so, like for my instance, I kind of got into public health because in college, I went on a medical mission trip with Global Medical Brigade, shout out to them, to Honduras, where we had like 5 clinic days, but then we had a couple of public health days where we built a water trench and we also built like eco stoves for a couple of the families in the village because with the stoves that they were using like at the time, they were just inhaling a lot of carcinogenic fumes. So in Honduras, I kind of saw like the health disparities and the lack of access to care in rural communities, but in the global setting. And I came back and I was like, I kind of want to learn what it's like here. And so I started working in a free clinic and it was just like eye opening. But then I'm like, I really need to learn more. So that's why I'm in this program.
I feel like that's super interesting because I feel like a lot of people go like globally to do public health like groups and mission trips, but they forget about their own area. And like public health is something that's an issue like everywhere, not just like in non-first world countries. And yeah, so check out on your neighborhood. But
yeah,
sorry for interrupting.
No, you're
yeah,
totally
I just
good.
had to say that because I feel like a lot of men, especially pre-med students,
yeah,
they go abroad, but don't forget about your neighborhood too.
Yeah, in the free clinic, it was like I worked at like a obstetrics clinic, and it was eye opening, and which is why I'm here. Great stuff.
That's crazy. A week can like jumpstart all of this,
right? You know? Yeah, I think everyone should do a medical mission trip because I think it's like it's good to see what's going on in like other countries, but it also opens your eyes to what you were saying, like our own countries. So, what about you, Joe? How'd you get into public health?
Well, actually, back in college, I didn't take any public health courses. What? I was more of a science kind of. I used to take a lot of science courses.
What was your major?
Well, I double majored in biology and neuroscience.
Smart.
So I graduated in 2020, and that was the year when COVID inspired me to learn more about public health, and I decided to pursue a master's in public health because COVID inspired me to learn more about it, and now I'm thankful that I ended up choosing this program.
That's so sweet.
I also had some public health experience in undergrad. I actually started undergrad as a biology major because it was pre-med. But I ended up, there were a couple classes that were required on the like pre-med track that had some connection to the public health studies department. And right before COVID happened, I switched my major because I was like really enjoying those classes and I loved the connection to like real world like applications to like what we were learning and looking at health disparities and health inequities of different groups and different populations. So I went forward with that, and I'm still hoping to go to medical school and be a family doc and apply everything I've learned, and hoping this degree will further enhance that for me.
I think you're so lucky that you were you were a public health major in like one of the biggest like public health crises like that we've seen.
It was actually really weird because like I started the major like a semester before COVID happened. So like the classes started out as like, this is what we would do if this happened. And they gradually became, this is what we should be doing right now. Because like we were in the middle of a public health emergency.
Did y'all have a lot of projects related to COVID?
Yeah.
I feel like you have to.
You have
to take advantage
I feel like
of it.
we are. Like right now in our program. Yeah.
No, our courses definitely evolved. And I remember a lot of professors would actually say like, before we used to like focus on, I don't know, like influenza, like an influenza outbreak or malaria or something like that. But we're going to do COVID because that's obviously.
It's current. Yeah.
Well, I mean, it's sending everybody home and inspiring people like Joe to learn more about public health. So, yeah.
I was biomedical science, and so we only had like one public health class, and it was before COVID because I guess I'm old, but we did one project and it was not related to COVID at all. It was about like a zombie apocalypse, and it was like their way of teaching us to be like health leaders. and we like killed the entire town. We were not good at it.
When you just mentioned zombie apocalypse, I thought of Last of Us,
Oh,
like
yeah.
the HBO show.
Yeah.
Amazing show. Everyone watch it.
Yeah.
Sorry.
No, but
go
we
ahead.
did that, and it was like, we're okay. So like these people have it now. What are you gonna do? And we completely failed. Like the whole town turned into zombies. It was awful. But I would say that for most people, public health came into like the forefront because of COVID, which like for Joe's situation and like not really your, but like kind of yours. And I would say that's the same for me because I did a lot of public health things throughout undergrad. I worked as an EMT and I was a part of a nonprofit called Hands on Peru, which is kind of similar to Aquila's. And it like showed me public health, but it didn't really like interest me much. Like it was definitely something I wanted to do, but I wasn't super passionate about it until during the COVID pandemic. I worked at a COVID unit as a technician, and let me tell y'all, it was awful. I hated it, and I was a pre-med, and I wanted to be a doctor, and I was like, heck no, this is awful. They treat you so like so low,
Yeah.
like the administration. And so that actually made me want to go into like health advocacy and health policy, which is also a part of public health if you didn't know. And so that's why I'm here, because I wanted to do health advocacy, not only for like staff but also like patients
Like,
too,
yeah, like
to give them a
patient
voice
advocacy.
too. Yeah. And I would say that my experience with COVID being like the first thing to bring people to public health is probably what it is for most people.
Yeah, I'm
Yeah.
sure like for our parents too, like no one knew what COVID was. Like I remember the day actually that everything shut down. I was in Daytona because it was my spring break. And I had just gotten an email from my university saying like, don't come back, like classes resume in like April. And this was like, they gave us like 2 weeks, right? They gave everyone like 2 weeks. And I was like, I was so happy. Mostly because I was so naive and I didn't understand like how big it would be. And
Right.
obviously it was huge.
It was like 2 days. They're like, oh, we're only extending spring break like 2 days.
yeah, it was like
And they're
nothing
like,
at the
oh, a
time.
week. Okay, like a month.
And then it was like, oh, the rest of the semester, like, don't ever come back.
No, yeah. I actually, when I found out, I was in Peru. It was an experience because I was supposed to go to, because I was a part of that Hands on Peru, and we were doing like COVID advocacy and like learning for like the communities. And the border shut down before they even told us that COVID had entered Peru, because at the time there were 0 cases of like COVID. And so in the span of like 1 day, it shot up to like hundreds of cases, and they shut down the borders. They're like, you have 12 hours to get out.
Wow.
And
So you weren't stuck there.
Oh, I couldn't get a flight because they were like thousands of dollars. So I
Right.
ended up actually getting stuck there. And
For how long?
I think it was about a month.
Oh,
And
wow.
so I was in a hotel, and it's kind of crazy. Like we were like one of the first COVID deaths like at the hotel, and it was it was a hot mess. But that's a story for like another time. And it was another time. Yeah.
No, I was
But
gonna say my parents would be freaking out.
it was an experience, and I met a lot of people. Thankfully, there were a couple nurses that were like quarantining in our hotel. But yeah, it was an experience. And eventually, the U.S. Embassy like evacuated us.
They were
But
like, everyone out. Like,
Yeah.
we gotta get her. Yeah.
I got lucky because I was like a single female traveler, so they were like, "We'll take you out first." I felt bad for the other U.S. citizens
Right.
in their house, and the hotel was like, "Bye."
See ya. Peace.
Yeah, but other countries got out a lot faster. I was kind of sad about that. Yeah, but there have been like a lot of historical milestones that have like determined what public health is, and I think the big 3 ones that most people would say define public health are the lung block, I think, and then lung block,
Fluoridosis.
fluoridosis in water, and then
Fluoridation.
fluoridation in water systems, and then
Polio.
polio, yes,
And the Salk vaccine.
and the Salk vaccine that came with the polio pandemic.
Yes.
So I can tell you a little bit about the lung block, which it started in 1895. So it was so tuberculosis was spreading in Europe and in the United States, including like especially in New York City. and New York City Health Department used new laboratory techniques back then to diagnose tuberculosis cases. And there was like one particular block there that was known as the lung block, which harbored hundreds of cases, and it became a symbol of poverty and urban living conditions that reformers used to make a change. So that was one of the earliest incidents. So that's 1895.
I remember when we were learning about that, sanitation was a huge part of it all, and like it was like disproportionately, I'm pretty sure, like affected minority populations, and it's so sad to even like, and I'm sure like reforms were made because like mostly because of like the sanitation as well.
I think it was a big milestone for health advocacy in general, but
and I also go ahead.
Go.
I was gonna say, like, I think like also like when people think about public health, we like touched on this a little earlier. Like it doesn't have to be like a big event. Like sanitation at the time, like that actually had to be like combated, like as a country. Like we had to fix not only for like the lung block, like just in general as well.
A lot of good came from pretty awful thing for sure in terms of like detection and like epidemiological like steps forward, and then also like those sanitation changes that propelled the movement after that.
I feel like a big trend in public health is like action being taken after a crisis happens, because the prevention isn't really talked about much. And so to get the public's attention, like the like pandemic has to happen, and then the like policies will come flooding through. Which is kind of sad to think about, but
I feel like that's how a lot of things are. You know?
Like even in medicine, like preventative medicine is just like not like it's just not a thing in a way. Like I mean, I think it's also like a lot of people just like don't think about it in a way. They're like, oh, I go to the doctor after I get something. I'm not going to take care of myself before. But I think that all comes back to also like knowing what's actually happening. Like health literacy is like a huge component of preventative medicine.
And going with that is like communicating exactly what the risk is that's associated with diseases or risks that different populations are exposed to.
So after the lung block, the second big milestone was the fluoridation.
Yeah, not fluoridosis.
No,
not
fluoridation of drinking water, which happened in 1951, but it started in 1901, which was so long ago. But this was such a big milestone that the CDC still finds it to be one of the greatest public health achievements of our century. And I know.
Yay for us!
Yes. So it all started in 1901 when a young dental school graduate named Frederick McKay opened a dental practice in Colorado Springs. And when he worked there, he realized that all of the locals had like brown stained teeth, like so much so that it looked like it was coated in dark chocolate.
Gross.
That's kind of gross, but for some reason that stain was super like resistant to tooth decay. So yeah, but it's kind of beauty standard wise not the most
not the
appealing
best
thing. And so it wasn't until later that he found out what caused that stain, which prevented like tooth decay, and it was high levels of fluoride in their water. And he found this out by looking at like multiple towns with that brown stain. And from this, they did a lot of research, like the NIH, to determine like safe levels of fluoride. And they were like, hey, I wonder what would happen if we put this in drinking water at like safe levels that wouldn't cause the staining, but would help prevent the tooth decay. So in 1945, which is like a lot longer than 1901, like McKay's like not even a part of this
like
anymore.
40 years later, basically.
No, yeah. And so they're looking at his notes, like they're looking at his like journals, but he's not even a part of it anymore,
right?
I believe. And they did a 15-year study in 1945 in Grand Rapids, Michigan, to determine if adding fluoride to drinking water at safe levels would help fight tooth decay. And it was highly successful. And because of it, prevalence of tooth decay has decreased dramatically. And so from this city, other cities were like, hey, I want that too. And so it just expanded. And as of 2018, 73% of the U.S. population was served by a public water system with access to fluoridated water.
Wow.
It's
Yeah.
crazy that number's not 100%, given like how clear the evidence is that it does prevent tooth decay. Like I know that my hometown actually doesn't have fluoride in the water because people voted that they didn't want it. So
What town?
And wait, why do you think that is? That's crazy.
I know. I think a lot of it stems from like what we were talking about earlier, like government mistrust or maybe not fully understanding the benefits of it or the science behind how it works, and they just think this random chemical is being added to, what I'm going to drink every single day. So that's at face value, that's scary. But when you understand the science behind it,
It's so evident that it
yeah,
helps.
it's a no-brainer.
Yeah.
But
Because when you look, I think on the CDC website, they have like a chart that shows cavities in the U.S. since like the 1960s, which is about when like the fluoridation started to like spread, and it's just like a huge decline in cavities.
I can't even imagine like how many cavities I would have if my water wasn't fluoridated. Like
we have a lot of dentists where I live.
Really?
Yeah.
Well, I guess yeah.
I feel like you have to
Yeah.
at that
Yeah.
point.
They get so much business just because people are coming in with cavities all the time. And that's just like, people are okay with that. That's the norm.
So
Same.
I'm like definitely highly susceptible to cavities. So I couldn't imagine if I didn't have fluoride in my water. Like I feel like my teeth would be gone.
Like they would just be falling off.
No, I'm sure not that
I
much.
eat like way too much like gummy bears for like me to. I don't
Oh
know.
my
It
gosh,
doesn't even
yeah.
make sense.
You
Like I
mean
can't fathom.
Haribo?
Yeah, the
Yeah.
best brand
Yeah.
ever.
Yes.
I'm not sponsored. Yeah,
No,
I'm not
sponsor us.
sponsored, but I
If
would
you
love
want
to
to
be sponsored.
sponsor us,
Sponsor us
Yeah.
and HBO Max.
And HBO Max.
Yes.
Actually, funny story. Side note. My dad, he's such a sweetheart. Every single time I go on vacation, he like gets me like the big pack. It's like $8.
Really?
It has like
Oh, wow.
almost like 200 gummy bears. I'm literally telling you like that, like for like a 15-day vacation, perfect snack.
That's awesome.
Wow.
Yeah, it's great.
Yeah.
It's fab. But I'm going to
Go
transition.
back to-
Our last milestone is the polio
Mhm.
outbreak. So polio is highly infectious disease, and it mostly affects like young children, and it leads to spinal paralysis, respiratory paralysis, and then like the worst outcomes, obviously, heartbreakingly death. And for those who overcome polio, they usually have like deformed limbs. They have to use like leg braces, crutches, wheelchairs. It's so devastating. And actually sometimes people who did have polio, when they had like respiratory paralysis, they actually created an artificial respirator to like help them just like breathe and stuff. And you would think that like polio is just like recent and stuff, but it's actually been around like prehistoric times. Like ancient Egyptian hieroglyphics. I think I got that. I can't get it right for my life.
It's okay.
But the worst recorded outbreak was in 1954, and it killed over 3,000 people. So the government was like, okay, we need to do something about this. Like, this needs to be fixed. This needs to be corrected. So a U.S. physician, Dr. Salk, actually created the first successful vaccine, yay for us, and he tested it on himself and his family first.
Could you imagine that? Like,
That's crazy.
I don't know.
I would-
I like to think I'm proud of the work that I produce, but I don't know if I would do that. you
I
know?
guess he was so confident in.
Have you ever been like that confident about anything that you made? No.
Every single freaking exam I've taken.
No, I am the least confident person, but I guess it's like polio at the time was pretty contagious.
It
Like,
was just
it
so
was-
bad.
It was spreading pretty fast. So
And
I
I-
guess it's like
And there were so many like tries. Like so many people were trying at this point that I guess he was just like, what can I lose? Like it was just so it was
Right.
heartbreaking. It was such a heartbreaking disease. Like even if you go search it up, it's terrible to see those images.
Mm.
And
Didn't one of our professors say that he
Yeah.
he remembers one of the experiences there or something?
Yeah, no, he was one of the first people to get the vaccine, I think.
that's it,
Oh,
right?
ooh.
Oh, wow.
And he had a picture.
yeah,
It was like a
they
picture
found,
that
he found a
showed us.
black and
Yeah.
white picture of him standing in line in
Dr.
elementary-
Nelson.
Yes, yes,
Dr.
it was.
Nelson.
Yeah,
Okay,
yeah.
yes. Oh my god.
that's so funny.
no, that's
I
crazy.
do remember that. And he had a pic. It was like in
Yeah.
a newspaper or something, right?
That's right.
And I didn't believe it because I'm like, there's no way that's you.
He was
That's
like,
so
that kid
funny.
right there.
It's
And that
me.
kid was my
He
bully.
could
and
also
that
have
kid...
just been lying.
That's
I
also
asked
true.
him. I asked him
Yeah.
later because I had class
He was
with
being
him,
serious.
and he was like, "No, that was actually me."
But if it happened in 1954, that's close enough. To
It
actually-
could have been our
Mhm.
teachers,
Yeah.
but I'm gonna do it with my kids. I'm gonna like pull up historical pictures and be like, "That was me." Who's gonna fact check me?
No one.
No one.
Anyways, and then a year later, he successfully vaccinated 1.6 million children in Canada, US, and Finland.
That's fast. That's like the COVID vaccine.
Yeah, crazy,
kinda.
crazy, and at that time, like crazier, I feel.
Mhm.
Mhm.
And now CDC recommends 4 doses for the polio vaccine, and it's just a part of like our routine childhood vaccination schedule. So like you can go to any one of our charts and it's there. So yay for us.
Yay. I'm like definitely scared of needles. I still get my vaccines, but I literally I have to like turn away and like grab something. It's so sad.
Crazy.
Yeah.
I can't even feel them anymore. No, I know that sounds
I
like
cry.
sounds crazy,
It's
but I
so
can't.
bad. I don't know why. I like
No, some of them hurt though,
some of them hurt.
but then some of them you don't feel.
I feel like my first COVID vaccine hurt, but the other ones didn't.
Oh my god, the after effects.
Mhm.
I got
was
pretty
gone.
sick.
I was
Yeah,
gone
because
for
I
a
didn't
day.
have COVID, so like
Me
my
neither.
first, I was yeah, but yeah. So that was a big thing, and it's crazy to think about. Like our kids are gonna learn about like COVID as being probably a milestone in
A
public
big
health.
one. Yeah.
Yeah, which I wonder if it's gonna be added to the list of like these.
Yeah.
These are 4
4
historical,
milestones
yeah,
now, no more
So-
3.
and then
Yeah.
COVID. That'd
Yeah.
be so interesting to learn. But have you seen those TikToks of people like our kids learning about COVID and it's like talking about how awful COVID was? And then it was like me actually during COVID and it's like them doing a TikTok dance.
Yeah.
Because TikTok came out like right when the like
Oh my god,
quarantine
it like
happened.
blew up.
Yeah.
It blew up.
I remember
I mean, it was like my only, I hate to say my only, but like one of the biggest like safe havens at the time. Like it was like where you can just kind of like,
because what
Get
else?
out. Yeah, what else?
It was very lonely.
Watched a lot of
pandemic.
Netflix. too.
yeah.
Oh, what was like Bridgerton? Oh my god, that was like the big Netflix monster.
Vampire Diaries for me. I finished the entire show for the first time ever.
I'm a Teen Wolf. I'm a Teen Wolf.
Oh god. Okay, we can't be sitting next to each other.
Before we go, Joe, what's your favorite TV show?
That's a great question.
He doesn't have time for
The
TV.
last one I've seen was The Crown,
Really?
Yeah.
That's a good show.
That
Yeah.
is a good show.
season 5.
Yeah.
Is that your favorite season?
No,
Oh.
but probably season.
He has
4,
the seasons
maybe.
now. Wow.
I think it's season 4 when Prince Charles meet Princess Diana. It was like before the.
I've seen
the
a
dark
lot of
stuff.
like clips of that. Like
Yeah.
the Charles and Diana drama.
Yeah.
Yeah, it's insane.
They did a really good job with the casting.
Yeah.
I do have to say that. I haven't seen the show, but yeah.
Yeah, we're straying away from
Yeah,
public health
sorry,
a lot.
guys.
Yeah,
We should
but
probably bring it back.
yes.
But yeah, so this was our pilot episode. This
Mhm.
is season 1, episode 1, to put it in TV terms. But yeah, we're hoping to do this every week or few weeks and
So
discuss
awesome.
discuss different public health topics and invite some of our classmates and essentially professors or public health experts that we met throughout this time, and gain their perspective on maybe COVID or their different areas of expertise, but just continue a dialogue that allows for I guess public health to be more understood in the future. So yeah, I guess join us next week for our episode where we talk about
What's in your water?
Thank you, everyone.
Thank you.
Thank you.